Hi, it's Dr. Julia. I want to talk to you about something that I was just approached by a few people about the last couple days, and that is numbness in your hands. Now, there isn't really a disease or any kind of a name for that. As a chiropractor, what I know is that the nerves that go into your hands come from your neck. And so I want to show you kind of what happens if you're suffering from numbness in your hands. That is the last warning sign. Like, your body's already given you a ton of warning signs, like immobility, or not being able to move your head from side to side, or not having very good range of motion, checking your blind spot when you're in your car and you're getting into the left lane or something. That's one of the first things that people notice, is they just don't have that mobility. The second thing is pain. Of course, what follows when you can't move properly is pain. And then that very last thing is getting numbness into your arms and hands. And anytime you have numbness, it's a good idea to get checked by a chiropractor, because that's where our specialty lies. We're good at fixing the problem when it comes to numbness and nerve type problems. So what happens when you have numbness into your hands or your arms? Even when you wake up in the morning, and maybe you think it's your pillow or your bed or the way you're sleeping, or maybe you sleep with some dogs, or your husband's like a crazy, or your wife is a crazy sleeper and kicks you all night and stuff. Typically, that can be definitely part of it, but with your spine, the nerves here come out of these little holes in the neck, and all the way down the spine, really. This, as you can see, this is called the foramen magnum, and this is where the spinal cord lies. And then you have all these little nerve branches that come out here and come out between the holes of the spine. Now, these are all the nerves we have in our body, and they control everything in our body. So when those bones get out of place and they push on those little holes, there's not enough room for that nerve to do what it needs to do. And so what we do is we go in and move them into their correct place, and after a few adjustments, you start to feel better. The problem, though, lies within the fact that when you get numbness into your hands, this has been a problem for a while. This isn't something that can just be fixed with a few adjustments. Getting adjusted on a fairly regular basis will help with that. But a good chiropractor is always going to address the mobility issues too. So you have to have mobility in your spine in order to do anything and to keep doing things that you want to do. Exercise, eating really good, and feeding yourself good food when you repair your muscles when you exercise, and things like that are always going to make a huge difference in the way that you feel. And so chiropractic is just one of the things that can help with that. And now then, that said, that's the spinal issue. Now, there may be areas of restriction in your arms, in your elbows, shoulders, wrists, and a chiropractor can also look at those. Chiropractors will adjust any joint that's in your body. It doesn't have to just be in your spine. We adjust shoulders, we adjust elbows, we adjust wrists, ankles, knees, hips. We do it all. And so that is one of the things that I think a lot of people don't know. And so you can get a nerve entrapped in your elbow. You can get one entrapped in your shoulder. So it is a really good idea to get checked. But knowing the signs, the last sign of something being wrong is numbness. That's where you definitely want to get checked by somebody. Definitely a chiropractor, a physical therapist. It's just so important, because that is a sign that this is turning into a chronic problem, and then you're going to have issues down the road if you don't get it taken care of. So if you're getting numbness into your hands, it's a great idea to get checked by your chiropractor. Have a good day.